Hi everyone, my name is Alpha Kumar and I am going to explain about the newest improvement of nuclear in medicine field. Now, let us take a look at the principles of nuclear medicine. Nuclear medicine is actually a medical specialty which includes the usage of radioactive isotopes for disease diagnosis and treatment. Then, nuclear medicine also helps physicians to classify complex molecular activity inside the body's tissues and organs in a non-invasive and precise manner. After that, it also enables the early detection of disease and gives rapid monitoring of therapeutic responses. Thus, this is called nuclear medicine imaging. Nuclear medicine imaging. This technique uses low concentration of radioactive materials to detect, determine or medicate a range of diseases. Where, this includes several types of tumors, cardiac and pulmonary diseases, neurological disorders, and other abnormal functions. It functions by using the radio tracers, which, the radio tracers will be injected, inhaled or swallowed into the bloodstream of patient. In the form of gamma rays, it will be detected by a special camera and a device to produce images of the inside of your body as the radio tracer passes through the region being studied and emits radiation. It provides unique knowledge that can sometimes not be accessed using other imaging techniques and offers the opportunity in its early stages to diagnose disease. They may also illustrate whether an individual is responding to the treatment. The most common imaging device used is positron emission tomography (PET) scans. Positron emission tomography scans, or so-called as PET scans. A PET scanner is a large machine with a round, donut-shaped hole in the middle. It has looks which identical to a computed topography (CT) scan and magnetic resonance imaging (MRI). Then, positrons pose no risk in medical applications due to their tiny size and extremely low mass. Positrons emit gamma rays, which are X-ray like electromagnetic waves, but have shorter wavelengths. Procedures of PET scanning. First of all, the patient is going to lie on an examining table. Then, depending on the nuclear medicine test, the radio tracer is administered to whether intravenously, swallowed, or inhaled it as a gas. The radio tracer will run through your body and can take few seconds to few days before accumulate in the area under examined. Next, how radioactivity is transmitted is actually influenced by changes in blood flow or metabolism. Lastly, gamma rays, origins from the positrons emitted by the radioactive liquids, will be mapped by rings of gamma ray detector. Advantages of PET scan are: firstly, the scans are capable of identifying diseases before signs and symptoms emerged. Then, PET scans are the most reliable imaging instruments in terms of their ability to distinguish between non-cancer and cancer tumors. Continue to the second part of this presentation where we can see the latest research regarding PET scans. An easy way to glean more accurate knowledge from traditional medical imaging scans has been developed by experts in Japan. A study unit composed of atomic physicists and experts in nuclear medicine from the University of Tokyo and the National Institute of Radiological Sciences, NIRS, has created a timer that can allow PET scanners to distinguish tissue oxygen concentrations in the body of patients. By recognizing portions of tumors having rapid growth of cells quickly, the upgraded version PET scanners will contribute to a better cancer treatment in the future. Patients' experience in this future PET scan will be the same as now. Medical team's experience of conducting the scan will also be the same, just with more useful information at the end, said nuclear medicine physician Dr. Miwako Takahashi from the NIRS, which is also a co-author of the research publication in Communication Physics. For two factors, medical experts have long recognized that cancer treatment can be impeded by low oxygen levels in tumors. First, low levels of oxygen in a tumor are also driven by inadequate supply of blood, a distinctive characteristic resulting in aggressive tumors that are more difficult to manage and grow quickly. Second, low oxygen concentration affects the radiation, making it less powerful because the desired effects of radiation therapy on cancer cell killing are achieved in part by converting the oxygen present in the cells through radiation energy into DNA-damaging free radicals. Therefore, the identification of oxygen concentration in body tissues will notify medical experts on how to attack the tumors in patient's body effectively. In addition, Assistant Professor Kengo Shibuya from the University of Tokyo Graduate School of Arts and Science mentioned that the outcome is the same, but the lifetime is not. Our proposal is to distinguish the lifetimes of positrons using a PET scan with a timer so that we can map oxygen concentrations inside patients' bodies. Then, Shibuya also says that a team of researchers from Poland do a theoretical model report on the ability of positrons to reveal oxygen concentration last year. Following that, it drives the research team to bring it into practice. Even with COVID-19 pandemic-related restrictions, the research still goes on, and in just few months, it accomplishes its publication. Shibuya and his team are now planning to extend their work to discover any other medical knowledge that a positron might reveal during its lifetime. That is the end of this presentation. Thank you. Bye.